Welcome to the Causes or Cures podcast, your gateway to understanding health and groundbreaking medical research in a fun and easy to understand way. With Dr. Eeks as your host, join us as we sit down with the world's leading doctors and scientists to unravel the mysteries of health. From practical tips on well-being to the latest breakthroughs in medical research, we cover it all. Don't forget to subscribe. Now, let's ignite our curiosity and together dive into today's episode.
Hello, everybody, and welcome to Causes or Cures. I'm Dr. Eeks, your host, and I hope everyone is doing well out there. So today we're talking about psychedelic therapies that straddle the line between miracle and controversy, specifically Ibogaine and 5-MeO-DMT. Some call them dangerous, some call them life-saving, and some say they may be the future of mental health care. My guest is Dr. Martín Polanco. He is considered the most experienced Ibogaine physician in North America. Over the past 25 years, he has treated more than 5,000 people, including more than 1,300 veterans and special operators. His work carries unmatched clinical credibility in a field often clouded by hype and fear. So we're happy to have him here with us today. In this episode, just to give you guys an idea, we're going to cover the following. Number one, what Ibogaine and 5-MeO-DMT are, how they work in the brain, and what makes them different from other psychedelics. Why so many veterans and frontline workers turn to these therapies when living with tangled mental health challenges, including PTSD, addiction, depression, brain injury, things that rarely arrive one at a time. How his center guides people through treatment and integration, and why integration may matter as much as the therapy itself. What results he's seen, how long they last, and the factors that make or break recovery. The risks, the safety protocols, and the misconceptions surrounding psychedelic therapy. The Mission Within Foundation and its new scholarships to support access, which some of you folks might be interested in. Ongoing research with top institutions. And finally, should psychedelic therapies move into mainstream mental health care, or are we racing ahead of the science? This is a conversation about possibility, risk, and the urgent need for new tools in mental health, especially for our veteran population and frontline workers. So pour a cup of coffee, settle in, and let's get into it. All right, everyone, we are connecting to Dr. Martín Polanco, and we're going to talk about Ibogaine and other psychedelics, which is all in the news and kind of exciting. But first, Dr. Polanco, can you tell us a little bit about yourself and the work you do and how you became interested in psychedelics?
Thanks, Erin. So I'm a medical doctor. I grew up in Mexico. I went to medical school there, and I was always curious about psychedelics ever since, as a teenager, my dad took me to a peyote circle. So I was exposed to it pretty early, and I got to see people that I respected and that I admired doing this in a ceremonial way with indigenous elders. So I was fascinated by this. I read about it and just tried to get my hands on as much literature as I could. And when a family member was dealing with addiction a few years later, I knew that there could be a psychedelic healing for her. And we had tried everything that Western medicine recommends for addiction, and nothing was working. So I looked up Ibogaine online, and I found a practitioner. This was 1999. And she had such a profound experience that I was just blown away. And at the time, I was still in medical school. So I finished my medical training, went into my residency, but I never could stop thinking about Ibogaine and how hard it was to access for me. And I wanted to make it more widely available. So I decided to take a year off my residency training, and I opened up an Ibogaine clinic in Mexico City. And we started treating people initially for opioid addiction. And we did that on and off for about 15 years.
Oh, wow. So were you in residency in the States?
No, in Mexico.
In
So
Mexico. Okay. And it's legal there.
Ibogaine is not illegal. So
Oh,
it's
okay.
kind of this gray area where it's not regulated, but it's not on any list that says that it's illegal. So kind of by definition, something is not illegal. It's legal, but it doesn't mean it's approved. So
Okay.
it's not a drug you can buy in a pharmacy.
Oh, okay. Okay, I understand. But it's just different than where, in the States where it's still listed as what, a class one?
It's Schedule 1, which
Schedule
is the
one, sorry. Schedule one.
it's the most restrictive category.
Okay.
Basically, any drug that is on Schedule 1 is considered to have no medical use and high potential for abuse, which for Ibogaine is completely wrong. It has
Okay.
zero potential for abuse because nobody would do this recreationally, and it definitely has medical use.
All right. All right. So what drew, so I was reading, sorry, there's a huge truck. I was reading that you're working with veterans and frontline workers, and I do have a lot of veterans who listen to this podcast. So I was curious, how did you get connected to that community?
So through our work with addiction, we were like I mentioned, treating opioid addiction. So we were detoxing people that were on heroin and OxyContin, on fentanyl. And we started seeing some veterans come through the program that were dealing with addiction. And I was really struck by a couple of them that came through in 2015. So they reported not just that their withdrawal was gone, their cravings were gone, and that they were feeling better, but that their PTSD was gone to the point where they no longer met the diagnostic criteria for PTSD. And for a physician, and knowledgeable about mental health, like there's nothing in the Western arsenal that can actually treat PTSD to the point where you no longer meet the diagnostic criteria. We have tools that can help address some of the symptoms, but nothing that actually cures a person. And I know cure is a strong word because it implies something outside of you, but this is the closest, we have gotten to potential cure for these complex conditions. So, I made a mental note of that and we decided to do a brain scan on the next veterans that came through, just so that we could have some documentation about what was going on. And the next two veterans, we took them to a clinic in Costa Mesa. We did a brain scan before and one afterwards. And this was the aiming clinic. So they do a type of scan called SPECT scans. And even though the sample size is small and not clinically, not statistically significant because it was just two people, it was enough data for me to go to other veterans that were doctors to tell them that I had something that could potentially treat PTSD and traumatic brain injury. And at that time, we'd made the decision that we wanted to get into the space of treating veterans because I had seen what MAPS had done. And MAPS is the biggest nonprofit in the psychedelic space. So they do work primarily with MDMA. And they did a study on 30 veterans with PTSD. And they managed to get a lot of traction with it because it was garnering bipartisan support. So I made the decision to focus on veterans because I knew that they were going to be able to change the narrative and change legislation much quicker than treating addiction clients. Even though we
Yeah.
say we support addiction patients, we don't really. We judge them. We consider it a moral failing.
Yeah.
Um, Whereas with veterans, they got hurt through no fault of their own. And I think there's a lot of support, both from the Republican side and from the Democrat side.
Yeah, no, then that's a great point because we're talking about something that has tremendous political influence to either make it go forward, make the research go forward, or really send it backwards, as we've seen over history with psychedelic medications. And to your point, a lot of these issues are comorbidities, right? Like PTSD, you often see addiction issues with that. So that's why this is a very interesting discussion for me. But for those who are unfamiliar, can you talk a little bit about what Ibogaine is? How does it work? You know, just the basics.
For sure. So ibogaine is a natural compound that was initially discovered inside of a plant called iboga. So the plant is scientifically called Tabernanthe iboga, and then it's been used ritualistically in Central West Africa. It's been documented for hundreds of years, but it probably goes back thousands of years. So it's used as a rite of passage, it's used for healing. And Ibogaine is one of the molecules inside of the iboga plant, but there are dozens of different iboga alkaloids. It's just the one that's most studied. And it was used in France more than 100 years ago. It was approved as a microdose for treating low energy states. And then in the 1960s, Howard Lotsof, who was a film student and he was very interested in psychedelics and he was self-experimenting, somebody told him about Ibogaine and he just took it out of curiosity and he realized after he took it that his withdrawal to opioids was gone. So at the time he was using heroin as well. So he kind of just stumbled onto this anti-addictive properties that this compound has. So for people that are dealing with addiction, if you take opioids for a prolonged period of time, they cause physical dependence to the point where when you stop, you get the opposite effect. The opioids initially make you feel, warm and fuzzy and feel like sense of connection and love and help you sleep better. But when you get off it, you get insomnia, you get, sweaty, cold, you feel a lot of pain. There's emotional pain, there's physical pain. It's almost like having a bad flu and knowing that there's something that will make it go away. That's why people keep using because they just want to avoid the withdrawal. So it took away the withdrawal, took away his cravings. So that's how it was like discovered or rediscovered in the West for treating addiction.
All right. And you also work with 5-MeO-DMT, I think, or some people might know it as the toad medicine, or I don't know if there's a nickname for it. You work with that too, right?
Correct. We work with 5-MeO-DMT, which is again a natural compound it's found in plants, but it's also found in the secretions of a toad that lives in northern Mexico. And that experience is very short.
Oh,
It's smoke, and every time you take an inhale, it lasts about 5 to 20 minutes. So
really?
it's very powerful, but very short.
Huh. And there's a synthetic version too, only because I was reading about, how it's stressful for the toads and stuff, and there were some ecological concerns. But you also said it's from a plant.
Correct. Yeah. So you can get it from a plant. You can also derive it synthetically. So when they make it in a lab, they start with melatonin, and you can convert melatonin to 5-MeO-DMT.
Oh, that's cool. So, can you walk us through what a veteran's journey might be if, they show up at your center? What would happen?
So they would contact us through our website, fill out an application, and then talk to an enrollment guide. The enrollment guide is the person that'll hold their hand throughout their journey. She would then connect them to a screening nurse who would go through their pharmacological history, their medical history, do a brief, psychiatric screen, make sure they're not dealing with psychotic disorders or bipolar 1, which would be contraindicated with the treatment. When it comes to pharmacological history, there's a lot of drugs that interact with Ibogaine, primarily psychiatric drugs. So the patient has to be prepared and open to tapering off those medications before the treatment. There's also some physical health conditions that would preclude a person from getting the treatment. So specifically liver problems and heart issues, morbid obesity. Those are a few of the conditions that would, make somebody not a good candidate for Ibogaine. Once they pass the medical screening, some of the patients get a psychiatric screening with a psychiatric nurse practitioner who, again, just signs off on them being good candidates for the treatment. They would start the process of preparation. This usually takes about 4 weeks. They get paired with a therapist who works with them to prepare them for the experience. And a lot of what constitutes preparations for psychedelics, there's like physical preparation, there's mental preparation, and even spiritual preparation, because this is a pretty big experience. Once they complete that process and they're scheduled for a retreat, they would fly to San Diego, stay 1 night in a hotel, and then we take them down to Mexico, and it's usually a 4 or 5 day process where they take Ibogaine, and a couple days later they take 5-MeO-DMT. At the retreat, there's always a therapist present. There, at least 3 medical professionals during the Ibogaine administration and a veteran supporter, usually people that have gone through the program that are also veterans. Once that process is complete, we get people back to the US, and then they continue with their coach, with their therapist. We also pair people, or we refer them to a program called Wisdom Dojo, which is a 10-week meditation course that it's veterans teaching veterans how to meditate. And this is really beneficial because it extends the integration period by about 10 weeks and gives them the skill set to maintain some of the benefits from the Ibogaine experience. Because it's not a magic bullet, it's not going to solve all their problems. It gives them a window of time, which can be anywhere from 2 to 3 months, where they don't feel anxiety or they feel reduced anxiety. There's very little depression or no depression. Their brain works better. But if they just take that experience and don't do anything with it, then it starts fading. But if you continue
Okay.
to do the daily practices, then you can maintain the benefits. And the daily practices are, things that help your brain, like physical exercise, diet, meditation, yoga, cold plunges, getting your sleep under control, supplements, etc.
Okay, and you emphasized integration. I saw that on your website, and this is what you mean by integration, like doing all this other stuff?
Absolutely, yeah. So integration, from a psychological standpoint, is like how do you actualize what you learned during your journey into your real life? Like how do you bring it into existence? And what habits are you bringing into your life and which habits are you letting go? But then from a physical standpoint and from a, daily practice standpoint, I think, the physical exercise piece is super important. The, dietary piece is critical. And then, a lot of us have disordered sleeping. So getting that dialed in is also another important piece.
Now, do you guys recommend a particular diet or just kind of generally healthy?
Well, generally people do better when they're not eating processed foods. So
True.
that's the main thing. There is some evidence that ketogenic diets are good for mental health. So there is a center at Stanford, which is called the Metabolic Psychiatry Center, where they're treating schizophrenia and bipolar just through ketogenic diet. So that's a great diet for people to try, at least to see how it fits into their neurochemistry. You have to be in a state of ketosis for 2 or 3 weeks before you see the benefits. So it's a commitment, but I think that is something that people should explore.
And so each person, which I didn't realize, so they get Ibogaine and then they also get the 5-MeO DMT. They get both at the clinic.
Yeah, so the 5-MeO-DMT is optional. The Ibogaine is where
Oh,
people really come from, but most people decide to do the 5-MeO-DMT, and they seem to go really well together.
okay, okay. I didn't realize that. So they're at the clinic for like 3 to 5 days.
It would be 3 nights or 4 nights, so 4 days or 5 days. Yeah.
Okay, so I was close. Can you talk a little bit about the results you've seen with the veterans with PTS at your clinic, or anybody else who goes through your clinic? You work with a lot of people, first responders, and probably people in general who just want to come and try it out.
So we've seen a lot of veterans, also first responders, and we've also seen some football players. So we've seen at this point 12, former NFL players come through that were dealing with traumatic brain injury, and they've, experienced some benefits. What we're seeing for the veterans, and this has now been documented in several published articles, is improvements in PTSD, reductions in depression and anxiety. And then when it comes to traumatic brain injury, people are reporting improvements in learning, cognition, memory, and executive function. There was one study that was done at Stanford where they did brain scans before the treatment and then after the treatment. And they had a battery of neuropsychiatric tests. And they were able to show, like 83% reductions in anxiety, like 80% reductions in PTSD, or in the 80 to 90% success rate. And this is, in the month immediately following the treatment. So again, it's very important that the person, takes this experience and then keeps moving in the right direction. Otherwise, after 2 or 3 months, it starts to fade.
Okay, so 2 to 3 months, it looks good, and then it'll start to fade. At that
It,
point, do you
it'll
recommend
start to
going
fade.
back?
No, it'll start to fade if you don't do anything with it. But if you
Oh,
are following the daily practices, you can maintain the benefits indefinitely.
oh, that's an important point. So you don't like ever tell someone, oh, come back to the clinic, or I guess unless they don't do the integration or
We've had a few people come back that didn't do the integration, that didn't know, how important it was, even though we would
yeah.
tell. But it's still less than 5% of people that come back.
Okay.
Um, so this is generally a one-time treatment
Okay.
for most people.
That's good to know because I was just thinking of like cost, and you also have a coach that they work with, which is super important.
Mhm.
Yeah, for the integration part, because I was just thinking like some people might struggle with that just because it's something that they have to do. It requires some effort.
Yeah.
Yeah, yeah. So I wanted to ask you if you have any particular stories, success stories that stand out, or maybe someone who you thought, without breaking confidentiality, obviously, or like a particular challenge where you weren't sure and you were just kind of like, wow, it even worked for that.
I mean, we've seen people with chronic pain conditions have resolution from them. There, some complex migraine patients that we weren't expecting to see benefits, but they reported their pain was gone as well. So those I think they're most surprising. But yeah, definitely from there's so many stories. I mean, every retreat, there's patients that find benefit from this. Uh, Oftentimes the people that come through, they're dealing with suicidal ideation, so they're fantasizing or thinking about no longer being here. Not necessarily that they have a plan in place, but it just kind of comes into their mind, and afterwards it's gone. So that is pretty remarkable. Then also seeing people that are coming because they have PTSD and they have symptoms related to PTSD, but the medicine then shows them something related to their drinking, and then they stop drinking. Um, and this is pretty consistent across the board that it has a very powerful anti-addictive effect. And it's really important to, stop alcohol consumption when you have a traumatic brain injury, because the alcohol itself is inflammatory and will perpetuate the injury. Alcohol also causes disturbed sleep. So you're not getting proper sleep when you're drinking. Even though it knocks you out, it's not, restful sleep. So that is a really important component of healing.
Yeah, I couldn't agree more. I think like we're in the era where alcohol is really under scrutiny, for a lot of health things, whether it's blood pressure or, interfering with sleep. It's interesting just because it's so part of our culture, and how those two will pan out. Are there theories or do you know why this works, how it works?
So there's a few different theories, and there's different mechanisms of action. So there is documented kind of changes in the structure of the brain. So ibogaine stimulates neurogenesis, which means new brain cell growth, and it makes the white matter in some areas of the brain a bit thicker. So it's physically repairing the brain. It seems to be resetting neurotransmitter systems related to addiction. There's a lot of different ways that it's affecting the brain. There's another kind of theory that is now being tested, or they have a plan to test it at Columbia University, where they're looking at mitochondrial function. So mitochondria are the, organelles or the little organs inside of your cells that produce energy. And they have a lot of other functions beside that. But mitochondrial health is very much related to like mental health. And by improving the function of mitochondria, that's why we're seeing trans-diagnostic benefits. So it's working across different mental health conditions, not just addiction or PTSD, but chronic pain, anxiety, executive function, etc.
Yeah, yeah, that's right. I mean, because chronic pain certainly has a strong mental component. Uh, just to create the setting for our listeners, this is not like a hospital. People are, when you mention retreat, are people doing this together in a room, or can you kind of describe the ambiance a little bit?
For sure. So there is medical equipment because ibogaine does have some cardiovascular risks. So people are on a heart monitor. They do have an IV in their arm, and we do pre-medicate them with some, compounds that can prevent arrhythmias. And then the experience is in a group setting. So people are, on mattresses, but not necessarily interacting with each other. But they are in the same room so that we can keep our eyes on the monitors.
Okay.
5-MeO DMT, though, that is an individual experience where people go one by one. That's not a group experience.
Ah, okay, okay. And are people having like psychedelic effects, in this one room when they're taking Ibogaine and you guys are just monitoring them? Like,
Yeah, so I mean, from the outside, it looks like they're sleeping, interspersed with occasional purging. But from their perspective, like what they're experiencing is this very like vivid dreamlike state. So Ibogaine, even though it has been categorized as a psychedelic, a
yeah.
more accurate description would be a dream creating drug. So when you're on Ibogaine, experiencing the Ibogaine, you basically have these very vivid hallucinations that are projected on the back of your eyelids, and they're usually kind of self-referential. They're almost like the content of your memories being played out in visual format. So it shows you these little movie clips of your childhood, of your relationships, things that, didn't work out in your life for whatever reason. It just gives you some perspective on them, and it shows you uh, some context on the underlying motivations that other people might have had and why they acted the way they did. But then it also shows you how you're showing up in other people's lives. So it shows you that you are kind of the common denominator for all of your problems. So a lot of times, we are the hero in our own story, and it's not
That's
always
so
the
true.
case. Yeah.
Yeah. And sometimes we're not. We're self-destructive. Yeah, yeah, I get that. And this is like hours long. They're in this room and they're just laying there. There's not like walking around or anything.
No, no walking around. I mean, they get up sometimes to go to the bathroom, but we help them because Ibogaine has another effect, which is it causes ataxia. Ataxia means inability to coordinate body movement.
Uh-huh.
So, they stumble around and they're not very coordinated. And when they move, there's a sense of vertigo. So that's where the nausea and the purging comes in.
Oh,
So
oh,
it's like it's not a fun experience in that sense. There's a high body load in terms of the physicality.
okay. So people might be vomiting just
They
because of
could,
the.
yeah, I would say 60% of people vomit.
Okay.
They purge is the more common term in psychedelics because almost like an energetic purging as well. So it's not just the physical vomiting, but almost getting, bad things out of you.
Oh,
Um,
or like an emotional purging.
yeah, emotional purging as well. And this does go on for a long time. I mean, anywhere from 6 to 12 hours, people are under the effects of the medicine, and then it stops. Like the visual hallucinations, they stop, but then you're still kind of feeling a little bit altered and not 100% back, to your baseline for another 20 hours. And that time is usually like spent in deep introspection. So people are just thinking about what they went through, thinking about what they saw, and just kind of very quiet. Almost, it's almost like a state of meditation
Hmm.
where the chatter in your brain is just gone. We're just like, you're just present.
Sounds nice.
Yeah. And then afterwards, we get them some dinner, we talk a little bit about their experience, kind of what they went through. But yeah, it's definitely one of the longer psychedelics.
Yeah, yeah. I mean, I know there's some anybody who's taken like psilocybin or shrooms or something in Amsterdam, there's that like acute effect, and then there's, the effect that lingers for a while. So, I mean, I guess that's common though, I think, with like anything
For sure.
you take. Now, let's talk a little bit about side effects and safety. You've mentioned heart, you've mentioned purging, which made me think of, oh, are you monitoring like electrolytes, or do you ever get a dehydration case? So I just wanted to ask you, like, what are some of the safety effects and what do you do to kind of monitor them? Uh, yeah.
So before the treatment, they have been screened by a nurse, by a psychiatric nurse practitioner. And then, on our drive down to Mexico, we stop at a cardiologist office. They get an EKG and they get an echocardiogram, which is an ultrasound of the heart. So a cardiologist kind of signs off on them being in a good kind of physical state. We also get lab work to look at electrolytes, liver function tests, complete blood count. like a basic metabolic panel that also tells us about like kidney function. So there's a lot of kind of physical and medical preparation that goes into the experience. And then while they're on it, there's continuous cardiac monitoring to look for bradycardia, which is a slowing down of the heart rate, and then also potential arrhythmia. So there's always, three medical professionals there. We haven't had any issues in the 1,300 treatments that we've given to veterans. So it can be given safely, but it requires a lot of monitoring and supervision. And like you mentioned, like if somebody's purging excessively, they might get dehydrated, it might mess up their electrolyte levels. So we have an IV port where we can rehydrate them and give them electrolytes as well. And yeah, I mean, for the most part, it's you know, pretty long experience, but it doesn't give you more than you can handle. So
Okay.
it's
And now for the heart effects, and I have read, some case studies online and they talk about where they're obviously more common in people who aren't monitored. But are there underlying risk factors that might put somebody at a higher risk?
so the presence of certain medications could make the risk of arrhythmias higher. The effect that Ibogaine has on the heart, it's called a QT prolonging drug. QT refers to some of the segments on the EKG. So when drugs prolong the QT interval, if they're combined with other medications that do the same thing, you get this effect where it can cause an arrhythmia. So definitely people that are on specific medications, people whose electrolytes are, you know, not at normal levels before the treatment can also have an arrhythmia. The presence of drugs of abuse. So if somebody used cocaine or alcohol or, other drugs, just before the treatment, then that might make it more likely for them to have severe side effects. So we also do a drug screen, and if somebody pops positive, we just can't treat them. So they need to be off of all their drugs of abuse for 7 days before the treatment. For psychiatric drugs, they need to be off usually for 2 weeks before.
And what about the 5-MeO DMT? Is there a different kind of side effect profile that you're watching for?
Yeah, so also some drug interactions, specifically with some SSRIs and drugs that are MAO inhibitors could be problematic. It also can elevate a person's heart rate and blood pressure. So that's one thing to watch out for. That experience is so powerful that people are not there. It's almost like an out of body experience. So if they throw up, they could potentially aspirate the vomit. So we're always watching their airway. So there's a few kind of safety parameters. Some people become mobile, so they just try to move around with that experience, but they're not really present. So we have to make sure they don't bump into anything. So yeah, so having just trained practitioners and enough staff to contain someone, it can be given safely as well.
Okay, and it sounds like you do all the safety protocols, so you're safe, basically.
Yeah, we take all the precautions to try to make it as safe as possible.
All right. What misconceptions about these medicines do you encounter most often?
About Ibogaine or about psychedelics?
Uh, Maybe Ibogaine, or however you feel like answering the question. Psychedelics, Ibogaine.
Well, I think that we've come a long way, especially because of the veteran advocacy that has been happening in the country, where people are more educated because a lot of podcasts and, documentaries and, different shows that have come out. I think a misconception which a lot of people had was that if somebody who has PTSD would take a psychedelic, it could make it worse. And then, obviously, if you take it in the wrong context, it can potentially, destabilize you. But I think that's a misconception. I can't think of any others. I mean, maybe because I'm in the psychedelic world and, everybody's kind of like informed. But
Yeah, yeah, but like you have to reach people who aren't, you know?
yeah.
So I think well, to your point, I think there's fear around these types of drugs, like, oh, am I going to stay stuck in some altered state?
Yeah, that's a good point. So actually, yeah, I do kind of recall a few misconceptions. So often people ask us like, will I get addicted to this? Like, is this something that, will cause me dependency? And the answer is no. Like most psychedelics are not addictive. Some are, like ketamine can be addictive, but Ibogaine for sure is not addictive. And some people also ask us like if it will change our personality, like they don't want to become hippies all of a sudden. So they do have that concern, and it's not going to change who you are. You're just going to become a more present, less anxious, less
You
thoughtful.
start listening to the Grateful Dead and
Yeah, get your little dream catcher and
yeah, yeah.
Mhm.
But no, I get it. I get it. People, because it's not mainstream in the US, and people are like, well, what is this stuff? Now, the Mission Within Foundation, that's your clinic, or is it go by a different name? Just want to
So,
make sure.
Mission Within Foundation is a nonprofit that I started, and that one has raised money to provide funding for treatments, and it sent patients to different clinics. So it's not just sending them to the clinic that I run.
Oh, okay. So that's where you just launched. You have like millions in funding, which is awesome. And there's psychedelic therapy scholarships for veterans and frontline workers. That's amazing.
Correct. And that organization is run by a veteran. His name is Jay Kopelman, and he's a 20-year Marine officer who
Oh,
went through the program and who's now kind of helping, raise money and put more people through.
oh, wow. Okay. So he's leading that up. Okay. And so they can go to different clinics, not just here, but where are the clinics mostly, like the most common?
So I would say Mexico is the most common place for clinics to be located, but there's also clinics in the Bahamas. There have been clinics in Costa Rica. There are clinics in Brazil. There's some in Europe.
Yeah.
Um, Pretty much everywhere. It's just, 95% of the world, Ibogaine is not illegal. It's just 12 countries where they decided Ibogaine, shouldn't be allowed. The main one being the US.
And does the scholarship involve everything you mentioned before? Like,
The preparation, the
yeah.
integration, yes, all the things that I mentioned.
Oh, wow. That's great. And it's all covered. Wow.
Yeah, we don't, the foundation is not able to pay for flights or lodging in San Diego. Like if they get a day or two before, they'll have to cover that.
Okay.
Uh, but yeah, for the most part, the whole treatment and the pre and the post is covered.
And obviously this is not covered by insurance. I guess I should say that for my listeners because it's not approved in the US. But so you are also partnering with UT Austin Dell Medical School for research. Is that true?
We have three studies happening with UT Austin. We have a prolonged grief study that is looking at the effects of mushrooms on women that have lost a loved one and are dealing with prolonged grief. We have the an Ibogaine study where they are going to UT, getting a brain scan, then coming doing Ibogaine, and then going back to UT, getting another brain scan. So this is a functional MRI test, functional MRI study that is also looking at different markers of TBI and PTSD, TBI being traumatic brain injury. So we're almost done with that study, and we're seeing great results with it. But yes, we are working with Dell Medical School at UT Austin.
Nice. The grief one is so interesting. I've been talking to a lot of people about grief lately.
Yeah, and
And
they're still recruiting. So if we could put in your show notes a link to kind of the UT Austin page, I think that would be
yes.
beneficial because
Yes.
there is no, effective treatment for prolonged grief, and psychedelics are showing a lot of promise.
Yeah, and so I don't know if you know the recruiting protocol, but I guess it could be anything, someone who experienced a loss. And you said women?
It's for women, yes, and I think it was initially geared towards the military, but I think they've opened it up. So I'll send you the link, and then we can
Yeah.
have more
Yeah.
accurate.
Yeah, no. Yeah, send me the link. That's fascinating to me.
Yeah, I think you should also interview the doctor that's running it. His name is Greg Fonso. Well, there's two, Charles Nemiroff and Dr. Fonso, and I think they would be great guests for your podcast, and then they can talk specifically about that study and other studies that they have going on.
Yes, I would love that. Because grief is just one of those things where it's like, oh my God, that can sideline you. It can come on so suddenly and just sideline you from life. And it takes a while. All right, so let's get into some philosophy. so supporters, of these types of treatments, they'll say, hey, we're wasting lives waiting for perfect trials. Veterans are dying by suicide or overdosing, and PTSD is too much to handle. And then, you have skeptics on the other side who are like worried about the commercial clinics running ahead of science with risks not fully being understood. Given the results you're seeing and the work you've done for years, do you see this as something that should move forward as a mainstream mental health care? And do you foresee that happening in the United States? We can start there.
So there's a lot of data on Ibogaine. It was actually studied by the US government. They did studies at the University of Miami in 1994. So there's a wealth of data and millions of dollars the US government invested. It was just when it came, time for the pharmaceutical industries to take this compound and do larger scale clinical trials that they decided it was not something they could monetize because it doesn't fit into their profit model. Like they don't know what to do with a treatment that you only take once or twice in your life. For them, it's more
About the
beneficial.
shareholders.
Something that is like, almost like a subscription model, right? Like the drug that you take every single day, that makes a lot more sense to them, and they know how to monetize that. So it's unfortunate that it just did not kind of fit into these categories they have of how to bring drugs to the market. And I'm trying to remember your question, but I think
That's okay. No, it's okay. We can talk about pharmaceutical companies. So really the reason that it wasn't studied, and I think our listeners know, like, for a drug to be approved by the FDA, it has to go through these rigorous clinical trials, and they take time and they take a lot of money to get to the market. So you're basically saying that this was not studied because the pharmaceutical companies really couldn't see the financial benefit in it.
that is one piece. And
Yeah.
then the cardiovascular risk, that's another big one. That was another strike against it. That the fact that it has on the heart, that they
The
decided
heart risk.
there was too much liability associated with it, and that
Okay.
we're going to be able to get it through the FDA process. So that's still an issue that we have to contend with. Fortunately, there's now a lot of more interest and funding. For example, Texas just approved $50 million to study
Yes.
iodine.
Yes.
Hope is that enough trials and FDA level research can be done to demonstrate safety and effectiveness. But the
Yeah.
cardiovascular piece is still going to be something that might come up. You
No,
know,
and that's fair. That's fair because I mean, heart death is still a huge issue in our country the way it is. And then if you have a drug that impacts the heart, and liability and lawsuits, that totally makes sense. I get that aspect of it. But do you think, if, like, with studies and other data coming in, that this should be a mainstream mental health treatment one day, or do you kind of not see it happening like that? Maybe more of like, if a person chooses to try this therapy, they have to go to a clinic like yours.
I think this should be standard and should be available in the US and should be covered by insurance. It's very important that it remain kind of inside of a medical model because of the risks that we talked about. So I think if it becomes approved, it will be an inpatient procedure that is done at some sort of medical facility. But the benefits are so vast and so dramatic that it definitely should be available for addiction and for traumatic brain injury. Like we don't really have anything that treats traumatic brain injury in the West. We have symptomatic treatments, but nothing that addresses kind of the neuroinflammation and the like microscopic damage that has happened to the brain. So yeah, my hope is that it gets approved, and we've never been closer, with all the interests and support from
Yeah, there's a lot now. I know there's Texas. I don't know if there's any other states. Um,
Arizona has $5 million for Ibogaine research, and I know there's a new nonprofit called Americans for Ibogaine, which is doing really amazing work. And this was founded by Rick Perry and Brian Hubbard, and they are working on different states now. They were behind the Texas initiative, and now they're working to get other states to allocate money. Some of the money that they're going after comes from the opioid abatement fund.
mm,
So states won lawsuits against
Yep.
Sacklers. Some of that funding is for opioid treatment, and this would be the best treatment for opioid addiction. So hopefully, they're able to unlock that funding for this.
That's amazing that it can just work so fast and so effectively for addiction.
Again, I would say it's not a cure. I mean, it gets a person almost to the point to where they were before they started using. So it's not going
Wow.
to tie their hands and stop them from ever using again. Like they still have that choice. That it gives them back the choice. That's the thing. Like they now can decide to use or not to use. Whereas when they're dependent on the drug, they don't really have that choice.
So the way that it may, and that's, you bring up a good point. There's being addicted and there's the habits and the behavior that comes with that, but then there's the chemical dependency that
Yeah.
even if you want to stop, your body, the physiology is like, hey, you need this, buddy. So the Ibogaine, are you saying that it kind of stops more the chemical dependency part?
That's what it does most dramatically, and that is like measurable. Like there's some, you know, scales that you can use for objective opioid withdrawal. Like you can look at somebody's pupil size, you can see if they're sweating or not sweating, whether they have diarrhea or not diarrhea. So there's definitely the physiological component, but then the psychological component is that these visions that people are shown or these, vivid hallucinations that they're experiencing, it's content from early childhood. So it kind of helps them address the trauma, which is leading them to use drugs in the first place. It also shows them the consequences of their addiction. It's almost like that movie, A Christmas Carol, where, it comes and it shows them, the past, and then it shows them also the future of what's going to happen if they continue using. So in a way, it scares you straight because, there's no real, positive outcomes for heroin addiction, right? It's
Yeah,
generally jail or being,
death.
and mhm.
Yeah. I love that. A Christmas Carol, Dickens, Ebenezer Scrooge, right? And then,
Mhm.
yeah. And it was like that, the past, present, and future. Sorry, I love metaphors. So, uh, so if you could send a message to veterans and PTSD, folks who have PTSD or frontline workers who are really struggling, what would it be? And I ask that knowing that this, is not approved by the FDA. And obviously, you know, there's a lot more research to be had if it ever hits the conventional market. But would you say this is something that they should try?
I wouldn't say that. I would encourage them to look at different options first.
Yeah.
So there are, you know, different mental health treatments. I think the most accessible psychedelic option right now is ketamine assisted therapy. So that one can work for PTSD. I think mushrooms are safer than Ibogaine and they're more accessible. So I think people should first start with kind of more with less expensive and less risky treatments. I would also encourage people to look at the link between metabolic health and mental health because a lot of what we're seeing as mental health conditions are actually metabolic conditions. So addressing, insulin sensitivity, the processed foods in our diets, the level of sugar, the toxicity that we're exposed to. A lot of the men that we work with, a lot of the veterans also have low testosterone and low growth hormone, and this is related to the traumatic brain injury. So when you have a hit to the head, it can dysregulate hormone production, and this doesn't always show up right away. It can manifest a couple years later. So people don't always put two and two together. And even a subconcussive event, where you don't lose consciousness, but maybe you get your bell rung, that can cause inflammation in the brain, and again, dysregulate hormone production. And when your hormones are out of whack, your emotions are going to be out of whack as well. So I would, you know, encourage people to do a functional medicine approach. And unfortunately, that's also expensive and not covered by insurance. But there are some, labs that will do comprehensive testing and at least give you a good baseline.
Yeah.
And AI, you can upload your labs and it can interpret them. So there's just a lot of tools that are available now.
It's so
So
true. And but if sometimes if you go to a mental health practitioner, it's like the hammer and the nail. But like, for example, you might have low thyroid and that's manifesting as low mood and depression, right? And you're hypothyroid. So I agree with you. I think that you should get everything measured and kind of know if something's off for sure. But I don't think our system necessarily works like that for, those comprehensive exams. You know what I mean?
Correct. Yeah.
But so what would you say to, first I want to ask you, why did you say mushrooms were safer?
So mushrooms, they don't have any of the cardiovascular risks that Ibogaine does. I think to overdose on mushrooms, you almost have to eat like a few pounds of them. So not really something a person can do.
Not many people are going to do that.
Yeah.
Yeah. And
Um,
go ahead.
Experience is shorter as well. I mean, still recommended that you work with an experienced guide. It's there's some psychological risks, of course, but from a physical standpoint, like they're very safe.
They're very
Uh,
safe.
yeah,
And do they have the same impact on someone who has PTS?
I think they can help, especially if it's pure PTSD or just depression or just anxiety or just OCD. It can have profound benefits. Whereas Ibogaine is uniquely beneficial for addiction and for traumatic brain injury or mild traumatic brain injury, I should say. If somebody's brain injury is severe, it's not gonna, get them out of a wheelchair. But if it's a mild traumatic brain injury, the kind that, say, a football player has from repetitive knocks to the head,
Yeah.
then Ibogaine is really beneficial.
Okay, so that's an important nuance.
Yes.
Okay, so Ibogaine is mostly for or most beneficial in those who have the traumatic brain injury versus PTS, which some of the other things might be able to help.
Yeah, and there's a lot of overlap in the symptoms of post-traumatic stress
Yeah,
and traumatic brain injury. I mean, if you create a Venn diagram, they're virtually completely overlapping, except, say, hypervigilance. So it's very easy for somebody to get misdiagnosed with PTSD when the underlying issue is actually traumatic brain injury. But if you give somebody psychiatric medications like, Adderall and Xanax and Ambien and a bunch of different things in combination, who has a TBI, it's going to make it worse. It's not going to address the inflammation. So I think a lot of that is going on, unfortunately, that, people go to the VA or to their doctors and, they just ask them about their symptoms and they're, basing the diagnosis on symptoms instead of lab work. They can be, misguided or confused about what's going on in the person's brain and they just give them psych meds.
yeah, that's true. It's true. I talked to a doctor on here who's in Tel Aviv who does a lot of research on hyperbaric oxygen therapy, which I'm sure you're familiar with.
Mhm.
I think he just came out with a study. I have to read it. That's my plan for the weekend on HBOT, hyperbaric oxygen therapy, and PTSD. But they work with a lot of folks who have TBIs too.
Yes, it definitely works. It does require a number of dives, quote unquote, like of sessions with the hyperbaric chamber.
Yeah,
So it can get expensive, especially if somebody has to leave their,
yeah,
home to go to a different location for, 4 or
right,
6.
right. And I mean, and that's the issue with a lot of these therapies, right? Like they're not covered by insurance. They're not approved. So the cost is a consideration for everyday people. So
Mhm. Yeah.
last question, because I know you have to go. What would you say to someone who, is hesitant about psychedelic therapies?
I would say do research, look at the data, and then there's a really good documentary on Netflix called How to Change Your Mind. It's by an amazing filmmaker. Her name is Lucy Walker, and she worked with Michael Pollan. And it just looks at 4 different psychedelics. There's another one called Fantastic Fungi. It's also, I don't think it's on Netflix anymore, but it's a wonderful movie. But yeah, the How to Change Your Mind, Michael Pollan documentary is on Netflix. So I think that's a good place to start.
Aren't you in a documentary?
Not in that one, no.
Oh, okay. But you're in,
There's one that's coming out also by Lucy Walker called Of Night and Light, and
okay.
that one will probably come out at the end of the year.
Oh, okay. Of Nightlight. Okay. That's the one that I read in email. Martine, thank you so much. This was really interesting. And it's interesting what you're doing. It's certainly great that you're trying to help veterans when there's a lot of people struggling out there for so long. And I will include the links in the show notes. Is there anything else you think it's important to tell listeners if they're interested in learning more?
Well, it was a pleasure chatting with you. It was you're a great interviewer, so thank you for the opportunity to be in your podcast.
All right, Marty, thanks again. Enjoy your day there.
Thank you.
Okay, bye-bye. All right, everybody, thanks for listening to Causes or Cures. I will include all relevant links in the show notes, as well as on my blog. I always do a recap of whoever came on the podcast and make sure, all the links you guys might be interested in are there. If you enjoyed this episode, be sure to hit subscribe so you don't miss future conversations. If you can rate or review the podcast, thank you. Thank you. And please check out my newsletter. The link for that is always in the show notes. It's where I share written interviews with researchers from all over the world and stories you won't hear anywhere else. You won't want to miss them. You are missing them now if you're not subscribed, but hopefully you will subscribe. All right. And now it's time for the closing quote, and I will close with a Jerry Garcia line that always makes me smile. And here it is. We're like licorice. Not everybody likes licorice, but the people who like licorice really like licorice. Huh. Uh, okay. Yeah, Grateful Dead, right? Like, gotta love them. Until next time, stay curious, stay kind, and I will catch you on the next episode. Goodbye for now.